Okay, so the patient was my daughter Ella, who at the time of the incident was just under 18 months old. Ella had been staying the night at her grandparents' place and every night gets a warm milk. And at this particular evening had reached up after her milk had been warmed up and placed the whole palm of her hand and the bottom of her fingers and her thumb onto the electric hot plate and had burnt off all the skin. So when they initially recommended the dressing, the registrar, it was a wet dressing, I don't recall the name exactly, but I knew that it was effectively like a petroleum sort of style gel with the gauze on it. And when it was going, petroleum will dry out eventually and that gauze was going to stick to her hand. And that was my greatest concern, was what the post dressing, what that, when we were going to come back to the hospital and have that dressing removed, what was going to be the impact of both healing, initial healing, and also what was going to be Ella's pain that she was going to be in, because she was just under 18 months old. That was really important to me. I didn't want to have her scar either emotionally or physically as a result of the dressing choices that were being made. So 2 days later, we were told to go to the burns unit and I took Ella there and they were removing the gauze that had been put on there. As a result of the pain that she was in, she did have to go under, and because she just wouldn't sit still, even for them just to remove the initial bandage that was covering the gauze that was on there. They removed it and the nurses in charge were very honest in terms of acknowledging my concerns and also explaining that, the dressing choice that had been made was not the best. And that's when they pulled out the Methylex AG, which is the one that I had initially wanted for the registrar on that first night in the emergency department to put on there, because as they explained, that particular, the Methylex, comes off a lot easier and with less pain on the patient. And especially being an 18-month-old, that was the biggest and most important choice for me. It was not in any way aligned at all. For me, it was quite concerning, but also frustrating, because where the burns unit nurses and doctors understood what my concerns were and understood the needs of a patient who was just under 18 months old, their registrar at the emergency department, for me, it felt like all she was doing was sticking to a standard, this is what you do if you have a burns patient. Pay no attention to the age, pay no attention to what the long-term or what the impact's going to be when that patient needs to come back in from a pain perspective as well. And that for me was really frustrating and disappointing, because I didn't feel like the patient was being put first. I think for me, the greatest benefit of a better alignment within our health departments would be just the confidence. I, again, have limited knowledge when it comes to medical situations, but having done first aid courses and just general knowledge of how gels work, I knew from the outset in that emergency department that what they were proposing was not going to be as pleasant as can be when it comes to burn situations for my daughter. And I just want to know that the money, or rather the financial impacts, are not being the cause of motivations for our emergency departments, and there is actually a people factor involved, particularly when it comes to our young children. So thankfully Ella healed really well, and there is zero evidence of that scarring. And while that there was like zero evidence of any scarring. And while that can be put down to her age, there was a point there where they did flag the possibility of needing a skin graft post the dressings that they were putting on there if her body didn't respond. But thankfully, as a result of the silver dressings that they were using and daily moisturising, that wasn't a requirement. We didn't need to go under again. We didn't need to do a skin graft, and she is completely fine and able to use her hand with no problems.